Hi, I'm Alex Meyer. I'm a GP at Yardleywood Health Centre, and this is Leanne Hoy, who's agreed to be my volunteer for today. So the reason we're making this video is to demonstrate the use of the Microlife Watch BP Home A machine. And these machines have been procured on behalf of OHP in order to increase the prevalence of atrial fibrillation amongst our patients. Now, the Watch BP Home A machine will automatically detect for AF during a normal blood pressure reading. So, Leanne, if you're happy, I'm going to check your blood pressure today. Okay, so it's important that once the machine is in use, it's got a diagnostic mode and a usual mode. So we'll be using it in the usual mode, and that will take 3 readings. So if you just keep nice and still, what it's going to do is it's going to take 3 readings, and it will count down for 15 seconds in between readings. Now for each reading it will analyse the rhythm as well, and it will detect if there's atrial fibrillation, and that will flash up on the screen at the end if there is atrial fibrillation. So what the machine will give at the end is the average of the 3 blood pressure readings. So it's anticipated that this will be particularly useful for chronic disease reviews, where patients are coming to see the nurse or the HCA for their annual review. This would be patients who are already on a QOF register, say CHD or diabetes, COPD, patients who've had a stroke. And when they're coming for their annual review, they'll have their blood pressure recorded, but we'll use these machines instead of the previous machines that you were using in your practices. As you can see, this machine is extremely easy to set up and use, and it's now doing the second of 3 readings. And how's that feeling, Leanne?
That's fine.
Okay, good. Now, the reason why this project is so important is because we know that there's a very large gap between the observed and the expected prevalence of atrial fibrillation in the whole of the UK, but particularly within the Birmingham area. And it's anticipated that by using this device in routine practice for screening for AF, we'll be able to increase our prevalence. So OHP have been working on searches that will be imported into your clinical systems to automatically pick up the prevalence of AF in certain disease populations, and we'll track that at baseline, and then we'll also extract that data every 3 months. And what we're hoping to show by the end of the project is that we've increased our prevalence of atrial fibrillation amongst the at-risk group and closed the gap between the observed and expected prevalence of atrial fibrillation. So the machine's now doing the 3rd and final blood pressure reading. Okay, so that has completed the readings, and what I'll do is I'll just show you what the output looks like. So it's showing 119/73 is the blood pressure, the resting pulse rate is 76, and there's no atrial fibrillation, and so Leanne is a healthy subject. Thank you very much.
Thank you.